Assalamu alaikum. Today I'm going to read academic clinical case number 23, that is, a 4-year-old with an abdominal mass. This case involves a 4-year-old girl who has been unwell for 3 weeks, presenting with a combination of concerning symptoms. These include lethargy, abdominal pain, episodic high fevers, poor appetite, and issues with urination and bowel movements, like small amounts of urine and no bowel movements for 5 days. On examination, the child appears miserable, pale, and quiet, sitting on her mother's lap. There are palpable lymph nodes in the cervical region and bruising on her abdomen and limbs, indicating possible underlying systemic involvement or coagulopathy. Her temperature is elevated at 38.5 degrees centigrade, her blood pressure is 130 by 85 mm of mercury, and her heart rate is 110 beats per minute, indicating tachycardia and hypertension. Auscultation of the lungs reveals reduced air entry at the left lung base, possibly due to pressure effects or secondary atelectasis. On examination, a right-sided mass is palpable, extending from the costal margin to the iliac crest, suggesting a large retroperitoneal or abdominal tumor. Her laboratory finding reveals anemia and a mildly elevated white blood cell count and thrombocytosis. Elevated levels of urea and creatinine suggest impaired renal function, likely due to mass effect or obstruction. Giving this clinical picture, the most likely diagnosis is neuroblastoma. Neuroblastoma is a malignant tumor arising from sympathetic nervous system. It commonly occurs in children aged 2 to 5 years and often originate in adrenal gland or along the sympathetic chain. They frequently present with an abdominal mass accompanied by systemic symptoms like fever, lethargy, and hypertension. Neuroblastomas are unique in that they produce catecholamines, which lead to detectable metabolite like vinyl mandelic acid and homovanillic acid in the urine. The presentation of neuroblastoma is highly variable, ranging from localized tumors causing minimal symptoms to widespread disease with systemic effects. A careful examination of the abdomen, lymph nodes, and systemic signs is critical to identify this condition. If the tumor has metastasized, there can be additional signs, for example, lymph node enlargement in areas like neck or supraclavicular region is common. Bone marrow involvement may lead to anemia, causing fatigue and pallor. Bone pain, orbital bruising may also occur due to spread to the bone or orbits. The best investigation to suggest the diagnosis of neuroblastoma is a urinary catecholamines test, as neuroblastoma cells secrete excess catecholamines. Testing for metabolite like vinyl mandelic acid and homovanillic acid in the urine is diagnostic in over 90% of cases. This is a simple, non-invasive test that provides rapid results and strongly support the diagnosis of neuroblastoma. Imaging studies such as ultrasound, MRI, or CT would further define the size and location of the tumor. A biopsy of the mass is ultimately required for definitive confirmation of the diagnosis. Here is the first question asked in this case is which of the following investigation is most likely to suggest the diagnosis? Select one answer only. Let's rule out one by one. First option is bone marrow aspirate. Bone marrow aspirate would not be the first investigate to suggest the diagnosis, while neuroblastoma frequently metastasize to the bone marrow. Bone marrow aspirates are used to confirm metastasis diseases, not to diagnose the primary tumor. So it's wrong. Next option is serum alpha fetoprotein. Serum alpha fetoprotein is a tumor marker elevated in hepatoblastoma, not in neuroblastoma. Next option is serum cancer antigen 125. CA125 is a marker used for ovarian cancer. There is no indication of ovarian involvement here. Next is serum lactate dehydrogenase. LDH is a non-specific marker for cellular tumor and tissue damage. While it may be elevated in neuroblastoma, it cannot specifically suggest this diagnosis. So the most likely diagnosis is urinary catecholamines. That is a non-invasive, quick and reliable method to suggest this diagnosis early. It is diagnostic in about 90% of neuroblastoma cases and would explain the child's high blood pressure, abdominal mass, and systemic symptoms. Here is the next question. Which of the following laboratory investigations will suggest metastatic disease? Select one answer only. Let's rule out one by one. First option is CA125. As explained earlier, CA125 is a marker for ovarian tumor and has no role in detecting metastatic neuroblastoma. Next option is clotting studies. Clotting studies are important if there is clinical suspicion of disseminated intravascular coagulation, DIC, or coagulopathy, but they do not help in identifying metastatic diseases. Next is serum lactate dehydrogenase. While LDH levels may be elevated in advanced neuroblastoma, They are non-specific and cannot confirm metastatic disease. High LDH can also occur in many other conditions, including hematological malignancies. Next is urinary catecholamines. Elevated urinary catecholamines suggest the diagnosis of neuroblastoma but do not indicate the presence of metastasis. So the answer is bone marrow aspirate. Neuroblastoma often metastasize to the bone marrow, causing symptoms like anemia, bruising, and thrombocytopenia. A bone marrow aspirate can detect neuroblastoma cells, confirming metastatic involvement and explaining bone marrow failure. It plays a crucial role in staging the disease and determining the treatment plan. Thank you so much for watching. This is all about from this case. If you have any question, comment below, like, subscribe and share.